More than 66,000 people die from heart disease or stroke in Canada each year, with the highest rates of heart disease in the country in Newfoundland and Labrador. For every minute a person goes without defibrillation, their chances of survival decrease by 7 to 10%. That's just 10 minutes between life and death. That's why in February 2020, we launched Project Heartstarter. And despite the many challenges of 2020, we've made great progress.
Heartstarter has 3 core components: innovative technology, defibrillator registry, and education.
41.9% of Newfoundland and Labrador's population live in rural communities, where response times are high and defibrillators are sparse. We've realized that on-ground delivery takes too long, and that time is a critical aspect in a cardiac arrest. So we turned to the sky and thought, what if we were able to move as the crows fly? And there it was, drones. But it was more complicated than that. We searched for a drone that was not only fast, affordable, and equipped to carry a defibrillator, but also durable to withstand our province's extreme weather. But nothing fit this criteria.
So we worked with a local startup, AS Works, to design a drone with innovative technology
and provided a new market for the company, costing $7,000 to build with a yearly $100 maintenance fee. Our custom drone is able to deliver defibrillators within an 8-kilometer radius in under 7 minutes. It is fast, affordable, and reliable.
Whole idea was to actually have it as easy accessible as possible. So I took some inspiration pretty much from the small FPV racing drones and scaled that pretty much up and increased also the fuselage a bit to actually house the device. Fun to see that thing flying, and once you have put it together and see how powerful it is and fast it can be. It just improves the life. I mean, it's cardiac arrest doesn't mean not necessarily that you die, but you have also long-term effects. And if you can reduce even those long-term effects to minimum, I think the whole project was already its worth. And I mean, if you save one life, it's definitely worth. So yes, I'm really excited, and especially working together with you guys, that's really a perfect combination.
The drones won't replace current emergency services, but will instead run parallel to them. With Heartstarter, a call to 911 for cardiac arrest would mean the dispatch of an ambulance and a defibrillator-equipped drone, giving the caller time to administer the defibrillator before it's too late. We established a partnership with municipalities Newfoundland and Labrador, connecting us with towns across our province, and we started our pilot in the town of Holyrood. We also partnered with a drone company to provide training for the town's firefighters to be certified to fly our drones. Heartstarter will service over 2,500 residents by training their 28 firefighters. Although AEDs are made available in many public places, our province is the only province in Canada without a publicly accessible defibrillator registry. So we partnered with PulsePoint to help create a precise AED registry and have already logged 142 AEDs across our province. Understanding the importance of heart health and the use of AEDs is critical. Knowing our education component had to have a deep and lasting impact, we formed 2 incredible partnerships. We've reconnected with Succeed, now an independent social enterprise that our team began as a food security project in 2016. We're participating in the development and rollout of a sustainable superheroes education program. Our focus is on the Good Health and Wellbeing Unit, which has already impacted 1,056 students in 44 classrooms across 4 provinces. We've also teamed up with our local YMCA and together have launched a social media campaign sharing ways to improve heart health. Since the launch in January, we have reached 5,698 individuals. This month, our province returned to a full lockdown in response to COVID-19, leaving many vulnerable families without food. Through the YMCA, we provided food hampers to 40 families, which included our cookbook and the ingredients to make heart-healthy foods.
Since we're offering an innovative life-saving service, we knew that we needed the help of medical experts.
That's why we applied for the acceptance into a MedTech incubator Bounce Innovation. We've been in the incubator since January and have access to resources and networks to help establish us in the medical technology sector.
Being accepted into the incubator validates our innovative solution and helps position us for greater impact.
It's been an unusual year, but we persevered through the obstacles and chose to focus on what we could do instead of being held up by what we could not. Heartstarter has had a great impact, and we are just getting started.